the peritoneum, and what do we have inside the pelvis. And the pelvis is a part which is different in the male and female. So we'll also look at the different arrangement and the relationship. So what we are going to have it today, we'll see how the pelvic is arranged and what is the reflection of the peritoneum in the pelvis. Uh, it goes from the anterior abdominal wall inside the pelvis, and then it cover the structure inside the pelvis, and then come out from the posterior abdominal wall. So how do this the peritoneum reflect over the different structures? So what do we have in the pelvis? We have the ureter. So ureter, you have already read it in the posterior abdominal wall and along with the kidney. But today we are only concentrating on the pelvic part of the ureter, and that too will look in the what are the differences in the male and the female ureter. So about the ureter, it's in the posterior abdominal wall. It's a retroperitoneal structure, and it is a muscular tube which carries urine from the kidney to the urinary bladder. It is about 25 centimeter long. So this is the general description. Now, how does this ureter enter inside the pelvis? It is just passing in front of the bifurcation of the common iliac vessel that most of you can see in the model, that model which we have. So you have to identify the ureter. This is also, they used to give it in an exam. If they give you the posterior abdominal wall, they'll ask you to identify the ureter, or if they'll give you some radiological picture, again, they'll ask you to identify the ureter. Now, how could you identify the ureter in the radiological image? Which you have to know. They'll not ask you exactly the ureter, but they'll ask you in plain X-ray, they'll ask you about the site of the ureter, where you can find the ureter, and you know about that where you are going to look at the ureter in the normal X-ray, not contrast in the normal X-ray. So the ureter, the pelvic part of ureter has two parts. So you can see that it enters the pelvis by crossing the bifurcation of common iliac artery. So in this picture, you have seen that this is abdominal aorta dividing into the common iliac, which divide into internal and external iliac. And the ureter just passes in front of the bifurcation of the common iliac vessels. So this is the entry of the ureter inside the pelvis. And then from here, it moves till the ischial spine. So this is the first part of the ureter in the pelvis. That is from the bifurcation of the common iliac vessel to the ischial spine. This is the vertical part. And from here, it moves anterior and medially, and then it enters the urinary bladder. Now, in the male, there is the termination of the vas deferens. So in near the termination, it is crossed by the vas deferens in the male. And this is one of the difference in between the male and female. So while you are reading about the different structure in the pelvis, you should also note down that what are the differences in the structure in the male and in the female. So the first difference is that it is crossed by the vas deferens. And in the female, it just passes behind the ovary and reach the ischial spine. Same like this, but here it is related with the ovary. That is it's related the ovary which is anterior to the pelvic part of the ureter. And in the last part, it is crossed by the uterine artery here. While it enters the urinary bladder, it is crossed by the uterine artery. So this relation is very, very important. The relation of the ureter with the uterine artery, because the uterine artery supplies the uterus and in the female. And we have surgery, we call it hysterectomy, where the uterus is removed. So while the uterus is removed, we need to ligate we need to ligate the uterine artery. So, the surgeon mostly get confused, or they need to differentiate between the uterine artery and ureter. So because they are very, like, it's very difficult to differentiate between the uterine artery and ureter, because it looks very similar. So you have to know as a surgeon that how to differentiate between ureter and uterine artery. In ureter, you will see, because it is meant for the flow of the urine, so there is a continuous uh, a spasm, and there is a peristaltic movement in the ureter that you can see, and it is it is covered with a blood plexus, while the uterine artery, there is no peristaltic movement and it is not covered with the plexus. So you need to differentiate between the ureter and the uterine artery once you are in the pelvis and you want to remove the uterus in the female. Because if you damage the ureter, it is going to be a big loss. So just keep this, in your mind, that this relation of the uterine artery with the ureter is very, very important here, while it is crossing the uterine artery in the female. Now, the male pelvis, what are the structure you need to know, and what are the structure from anterior to posterior? So as you move from the pubic symphysis, the structure just behind the pubic symphysis, you will see the urinary bladder. So this is the first structure, and behind the urinary bladder, we have the male gland that we used to call it the seminal vesicles, where we have one structure coming from the scrotum, and that is the vas deferens. This is the ductus deferens or the vas deferens, and this is the seminal vesicles, two male structure. Now, this seminal vesicle is behind the urinary bladder. And then behind the urinary bladder is the rectum. You will see the first structure, urinary bladder, and just behind the urinary bladder, we have the seminal vesicles. And behind the seminal vesicles and urinary bladder is the most posterior structure, that is the rectum. So in the male, from anterior to posterior, just behind the pubic symphysis, we have the urinary bladder. Behind the urinary bladder, we have seminal vesicles, and the most posterior structure is the rectum. So this is the structure here. Now, the peritoneum covers the anterior abdominal wall, and then it covers this surface. This is, you will come to know, this is the superior surface, and then it goes behind the posterior surface, and then it comes out covering the anterior surface of the rectum. So in the male, uh, you will see it covers all of the superior surface and then part of the posterior surface of the urinary bladder, and then it comes out covering the anterior surface of the rectum. So this is the arrangement of the peritoneum in the male. Now, there is one important structure that today you have learned about, the benign prostatic hypertrophy. In the male, this structure is lying below the urinary bladder, and there is a fascia between, you have also learned about the digital rectal examination, where you can palpate the prostate. So in between the prostate and the rectum, there is a fascia. This is called rectogenital or the denovillier fascia. So this fascia is actually separating the rectum from the urinary bladder and the prostate in the male. And behind this is the Walder fascia. So remember, the D is this anterior and W is the posterior. So again, it dips down from the anterior abdominal wall, the peritoneum. It covers the superior surface, part of the posterior surface. So again, note down the difference in the peritoneum arrangement of the male and the female. So it covers all of the superior surface and upper part of the posterior surface, and then it reflect over the anterior surface of the rectum. So this is the arrangement of the peritoneum in the male. In the female, just behind the pubic symphysis, we have the urinary bladder. And then behind the urinary bladder, this is the female organ. This is the uterus. So this is lying behind the urinary bladder and in front of the rectum. So now we have three structure in contrast to the male pelvis. We have the urinary bladder most anterior, Then we have in the middle, we have the uterus, and behind the uterus, we have the rectum. Now, what is the arrangement of the pelvis? Again, it comes down from the anterior abdominal wall, cover the anterior abdominal wall. Then it is reflected over the superior surface of the urinary bladder. Now, you can see the difference here that it is not covering all of the superior surface as well as the posterior part of the posterior surface, unlike the male pelvis where it is covering all the superior and part of the posterior surface. And then it is reflected over the uterus, forming vesico-uterine pouch. So this pouch again is very important because this is the dependent part of the pelvis. So when a patient is standing, if there is any secretion in the abdomen and pelvis, it will come down here in the pelvis. So this is the first pouch, which is called vesico-uterine pouch. So what is basically a vesico-uterine pouch? This is the pouch between the urinary bladder anterior, and this is a peritoneal pouch between the urinary bladder anterior and the uterus posterior. Then it covers the fundus of this. This is the fundus of the uterus. You must have learned about this in your previous module. And then it dips down again and cover the posterior surface of the uterus. And finally, it reflected over the anterior surface of the rectum. So again, it is forming another pouch, another peritoneal pouch that is called as recto-uterine pouch. So in the female, the peritoneal reflection is different. So what we call it as a peritoneal reflection in the male and the peritoneal reflection in the female. So you need to know the difference between the peritoneal reflection in both male and female, how it is different. So in female, we have two peritoneal pouch. The anterior is vesico-uterine pouch and the posterior is recto-uterine pouch. Again, these are the most dependent part. If there is any inflammatory process in the peritoneal cavity, the secretion or the abscess or the blood will come down in the pelvis while the patient is standing, and it will first accumulate in the recto-uterine pouch. These are the most dependent part in the female. So this is what the anatomical arrangement of the structure in the male and female, and the peritoneal reflection is there. Again, you can see the difference here in the male and female. Again, in the male, just behind the pubic symphysis is the urinary bladder, which is covered by superiorly and part of the posterior surface by the peritoneal reflection. And just behind the urinary bladder, you can see over there, this is this is seminal vesicle, and from here it is reflected over the rectum. But in the female, after the anterior abdominal wall, it covers part of the superior surface. Now here it is full of the superior surface and part of the posterior surface. Here it is only part of the superior surface. Then it is reflected over the uterus, coming back again, and then it is reflected over the rectum. It is forming peritoneal pouch in the female, while we have only one peritoneal pouch in the male. Behind the urinary bladder, here it is the seminal vesicles. The same thing is there. In the male, we have one pouch that is between the rectum and the urinary bladder that we call as the rectovesical pouch. And you can see the reflection again, superior surface and part of the posterior surface, or you can say the upper part of the posterior surface is covered with the peritoneum. While in the female, this is the vesico-uterine pouch, and behind is the recto-uterine pouch, and only the part of the superior surface is covered with the peritoneum, not all. You can see here, all is covered here, only part of this is covered. So this is the difference between the peritoneal reflection in the male and in the female. Now let's see the urinary bladder. What are the things you need to know? Where it is located, what is the anterior posterior relation, what are the different parts of the urinary bladder. So it's located where? It is located behind the pubic symphysis. It's a pelvic organ, but in infants, they may be in the abdomen. So forget about the infants. Just remember that it is a pelvic organ. And the position is that in the male, it is slightly higher. Why? Because of the prostate, which lies just below the urinary bladder. So this is regarding their position. What is the shape? Uh, it varies. If it is empty, it is a pyramidal in shape, and this is normal anatomical. When it is full, it's become oval. And what is the capacity? It is about 500 ml. Now, what are the different parts you have to know? And tomorrow or day after tomorrow, you're going to identify the different parts. One is your apex. So this one is apex, which is connected with the umbilicus through the ureters. Then this is the superior surface. This is the posterior surface or the base. And then we have two infolateral surface. And behind the infolateral surface, we have the neck here. So this is the apex, which is connected with the umbilicus. And this is the neck here, which is, it is just covered with just below the neck. We have in the male, we have the prostate. So again, you can see if it is in the cross section, this is the apex, this is superior surface, this is the base of the posterior surface, and this is the neck. And these are the two infolateral surface because it is cut, so you can see only one of them. Now relation. Uh, relation, you can see it is better to see it, better to imagine, better to visualize rather than memorize. So what are the structures which are anterior? What are the structures which are posterior? So again, it is different in the male and in the females. So what are structures are related here? Anteriorly, it is pubic symphysis and is connected to umbilicus by urachus, which becomes the median umbilical ligament in the adult. Posterior surface, it's different in the male and female. In the female, it is the anterior wall of the vagina, but in the male, we have these structure. Remember, in the cut section, we have shown you that just behind the urinary bladder, we have seminal vesicles. And the seminal vesicles, there is another structure coming just supralateral to the seminal vesicle that we used to call it the vas. So these two structures lies behind the urinary bladder and they are related to the posterior surface. Just try to visualize these two structures also in the specimen we have vas deferens and seminal vesicles, and they'll sometimes they used to ask what is the relation of the vas with the seminal vesicle. So this is supromedial. Look at this, it is superior and then it is coming medial. So vas is supromedial to the seminal vesicle, and also it is related with the urinary bladder here. And the ureter. So this structure is ureter and this is the vas. So in the female, the ureter is related to the uterine artery, and in the male, it is related with the vas deferens. So you need to appreciate this structure while you are looking at this model or this specimen in the lab. Okay. Now, superior surface. What a structure do you think that it is related with the superior surface? Superior surface is actually, it is in contact with the abdominal content. So what are the abdominal content? We have the coils of the small intestine. And in the female, because it is anteparted position, it is slightly tilted towards the urinary bladder. So you can say that the superior surface is also related with the uterus. So this is again the difference. In the male, only the part of the intestine, you can say the loops of the coils or the loops of the ileum and or the sigmoid colon. But in the female, it is also the uterus, which is related with the superior surface. Infralateral surface. What do we have infralaterally? We have nothing. We have just retropubic fat, and we have the obturator internus, which structure form the lateral wall of the pelvis. It is the obturator foramen, which is covered with the obturator internus, and from there is a pelvic diaphragm, which is formed by the levator ani muscle. So infralaterally, you will see retropubic pad of fat and the lateral pelvic wall, which is formed by the obturator internus and the pelvic diaphragm, which is coming from there. So obturator internus is forming the lateral pelvic wall, and the levator ani is forming the pelvic diaphragm. And finally, we have the neck. It lies where? It lies inferiorly, and it is most fixed part. And in the male, rest on the upper surface of the prostate. A mucosa. What do we have? What type of mucosa we have? We have trans. What type of mucosa we have? We have lined by the transitional epithelium, and the muscle we have the detrussus muscle, which is the smooth muscle. Now inside, try to find out the trigone, which is between two ureteral opening and one urethral opening. So this structure is forming a trigone, which is smooth, unlike rest of the urinary bladder, which is thrown into the fold. We call it as a rookie. So this is the trigone here inside, which is between these three openings. You can see the trigones also. Now blood supply. What blood supply you could think of? Now what artery we have? You have seen that the ureter enters the pelvis in front of the bifurcation of the common iliac vessels, and the common iliac vessel divide into the internal iliac and the external iliac. External iliac, is for the lower limb. It continues as a femoral artery and supplies the lower limb. So the only artery which is left in the pelvis is the internal iliac artery. So the internal iliac artery supplies almost all the structure inside the pelvis. So what artery we have for the urinary bladder? We have one superior and one inferior. What superior? Vesical artery. So these two are again branches of the internal iliac artery. And in the female, the inferior vesical artery is replaced by the vaginal artery. The venous drainage is the same. And lymphatics, there is a difference between the arterial or the blood supply and the lymph nodes. The lymph nodes are scattered around the internal and external iliac vessels, and mostly, the urinary bladder drains inside the external iliac lymph nodes, and only few to the internal iliac lymph nodes. So the the artery or the veins is only internal iliac artery and veins, but the lymph node, they are scattered. They are scattered around the external iliac and internal iliac. And for the urinary bladder, they drain to the external iliac lymph nodes. Nerve supply, you have already learned about it. We have the parasympathetic. Parasympathetic is craniosacral. So cranial is not coming here, so the sacral is left. What sacral segment? We have already learned about it. It is S2, S3, and S4. This is parasympathetic. This is pelvic splanchnic nerve. And the sympathetic is thoracolumbar. Which lumbar? This is L1 and L2. So parasympathetic causes evacuation, that it leads to contraction of the detrusor muscle, that is smooth muscle, and relax, inhibit the action of internal urethral sphincter. So once the parasympathetic is stimulated, it causes evacuation of the bladder, and the opposite action is the sympathetic. Okay, so parasympathetic is craniosacral, and the sympathetic is thoracolumbar. So the lowest part of this is S2, S3, S4, and the lowest part of the sympathetic is L1, L2. Urethra, I think you have already learned about urethra. Urethra, we have a different parts in the male and the female urethra. Yeah. In the male urethra, we have 4 different parts. We have the part which is above the prostate, which is called pre-prostatic part. Then we have the prostatic part, we have the membranous part, and then we have the penile part. And this is a long, and the female urethra is short. Now, what is the length of the male urethra? It is about 20 centimeter from the internal urethral sphincter to external urethral sphincter. The external urethral sphincter is here, and to the external urethral orifice. So this is the total length of the male urethra, which is about 20 centimeter. What the different part? We have already mentioned above the prostate, then in the deep perineal pouch. which is the membranous urethra, and then the spongy or the penile urethra. We have a different part. The pre-prostatic is related with the internal urethral sphincter and it is involuntary. Here we have the internal urethral sphincter, which is the pre-prostatic part. What is the function? Okay, this is involuntary. So it maintains the urinary continence and prevent the retrograde flow of the seminal ejaculate inside the bladder in the male. Okay. Now, the most important part here is the prostatic urethra. And you can see the prostatic urethra. This is about 4 centimeter in length and it is widest and most dilatable part. So this is important to know, especially in this case, because this is all about the benign prostatic enlargement. And when there is the benign prostatic enlargement, it compress over the prostatic urethra and it leads to the obstructive symptoms. Now, if you take a cut section of the prostatic urethra, you have two walls, the anterior wall and the posterior wall. We have some features in the posterior wall that you can see tomorrow or day after tomorrow in the lab. We have the prostatic urethra, and in the prostatic urethra, you will see in the center in the posterior wall, not in the anterior wall. In the posterior wall, we have one important structure that is called urethral crest. So this elevation is called urethral crest. And on the center, we have here the prostatic utricle, and then we have two ejaculatory duct openings here. And on the side of this urethral crest, we have the prostatic sinus. So what are the things here? Urethral crest, and in the urethral crest, we have three openings. One central opening is prostatic utricle. This is the blind tube, and which correspond to the female uterus. So it's the remnant of uh, 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 the female uterus, and it has only one opening here, which is in the center of the urethral crest. And on side of this prostatic utricle, we have two opening, and you have seen what a structure is there behind the urinary bladder, the seminal vesicle and ejaculatory duct. Now, seminal vesicle and the vas deferens. And these two structures, the seminal vesicles and vas deferens, they join together to form the ejaculatory duct. The duct of the seminal vesicle and the vas deferens, they join together and they form the ejaculatory duct. So how this ejaculatory duct is formed? By the vas deferens and duct of the seminal vesicle. And where does this open? It opens in the side of the prostatic utricle in the urethral crest. And urethral sinus is for the prostatic. Now, this is the prostatic urethra, very important again, very important for your exam, and surgically also it is very important because you will learn later that to remove the prostate, we need to go through the urethra. This is called transurethral resection of the prostate, TURP. Transurethral resection of the prostate. So once you enter the prostate, you will see this structure. And once you have in the urethral crest, now this is like a red light. Don't go above this. Otherwise, you will damage the internal urethral sphincter. So once you are here, in surgery, they call it a verum montana. So once you are in urethral crest, don't go above the urethral crest. Now you can do the nucleation of the prostate gland from here itself. That is called TURP, TURP, transurethral resection of the prostate. Now, membranous urethra is the least dilatable part, and it's only about 2 centimeters long. And where does it lie? It lies in the deep perineal pouch, and it is encircled by the external urethral sphincter. This is a skeletal muscle. Now, again, the internal is a smooth, while the external is a skeletal muscle. It is supplied by the pudendal nerve. So this is, the least dilatable part, and it is encircled by the external urethral sphincter. And there we have two glands that is called bulbourethral gland that lies in the deep perineal pouch. But the duct of the bulbourethral gland doesn't open inside the membranous urethra. it pierces the perineal membrane and then it opens in the penile urethra. Now, uh, they might ask you, what are the content of the deep perineal pouch? So we have the external urethral sphincter and we have the bulbourethral gland. Duct is there in the superficial perineal pouch and it pierces the penile urethra. The spongy part is the 15 centimeter long. Its longest part. It extends from where? From the membranous urethra to the external urethral sphincter, and it lies in the bulbospongiosus of the pelvis. The female urethra is short. It's only about 4 centimeter long, and it has internal urethral orifice and the external urethral orifice. And again, here in the deep perineal pouch, it is encircled by the external urethral sphincter like veil. So we have two urethral sphincter. One is the internal urethral sphincter. This is a smooth muscle and involuntary. And then we have external urethral sphincter, which is in the urogenital diaphragm, the deep perineal pouch, and it is surrounded by the membranous. It surrounds the membranous urethra or the membranous part of the urethra. And this is a skeletal muscle. So what are the difference between internal and external? One is voluntary and another is involuntary. That is, voluntary is a skeletal and involuntary is smooth. Coming to the prostate gland, what type of gland it is? It is fibromuscular glandular structure surrounding the prostatic urethra in the male. So here you can see it is surrounding the prostatic urethra. Where it lies, just we have already mentioned it, below the urinary bladder and the neck of the urinary bladders, encircling the prostatic urethra. So this is very important here. If there is any enlargement, benign or malignant, it can compress over the prostatic urethra and it can give rise to the obstructive features. So what are the function? It produces the seminal fluid and which alkalinizes. This is alkaline and which neutralizes the acidity in the vagina in the female. Relation. What relation do we have? So you can imagine from here. This is anterior and this is the posterior. We have superiorly. We have this is the neck. Anteriorly, inferiorly, this is urogenital diaphragm. Anteriorly, it is pubic symphysis, and posteriorly, it is the rectum. Which part of the rectum? The ampulla of the rectum and rectovesical septum, Denovalius fascia. And this is a very thick fascia, and it resists the spread of the cancer from the prostate to the rectum or from the rectum to the prostate, the Denovalius fascia. And laterally, again, what a structure we have laterally? Laterally, we have the pelvic diaphragm, which is formed by the levator ani muscles. Very easy, not very difficult. Lobe. This is very important for you to know about the lobes. So we have anatomical lobe and we have the surgical lobe. What lobe we have? Now, with respect to the urethra, you can see that we have lobe anterior, that is called anterior lobe. And then with posterior to the urethra, this is divided into two parts. You remember in the posterior wall, we have the opening of the ejaculatory duct, which is formed by the vas deferens and the duct of the seminal vesicle. Now this is dividing the posterior lobe into two parts, this upper part and the lower part. The upper part is called the median lobe and the lower part is called the posterior lobe. Now look at the median lobe. This is very important. You have the enlargement, the benign enlargement here in most commonly in this lobe, the median lobe. And the median lobe is between what? Median lobe is between the urethra anteriorly and the ejaculatory duct posteriorly and behind the neck of the bladder. So this median lobe is compressing over the neck, and in the neck we have here the internal urethral sphincter. So if it is enlarged, if this lobe is enlarged, it is, less likely to produce the symptom. But if this lobe is enlarged, the median lobe, it will press over the sphincter and it will lead to the obstructive symptom more than any other lobe. So this median lobe is most of the time enlarged in the benign prostatic hypertrophy. This is the anatomical division. So we have three lobes, which you can see from this section. And then there are two lobes which are lateral. Those are called right and left lateral lobe. So here in this picture, you can see we have two lobes. So there are five anatomical lobes: anterior, posterior, median, and two lateral lobe. And then surgically, we have divided it into three lobes. One is around the urethra. This is called periurethral zone. And in the periurethral zone, we have most commonly, we have the benign enlargement. And then after the periurethral zone, we have the central zone, and then we have the peripheral zone. So anatomically, we have five lobes, but surgically, we have only, we have three lobes: the periurethral zone, central zone, and the peripheral zone. Periurethral zone is mostly related with the benign enlargement, and the central zone is for the carcinoma. So if there is a carcinoma which doesn't affect initially the periurethral zone, is it will produce the symptom later on. It will not initially produce the symptom. But the benign enlargement, because it affects the periurethral zone means the zone around the urethra. So it will produce the compressive symptom very soon. So this is about the prostate, anatomy of the prostate. Same thing is there. Now blood supply. Again, this is below what? This is below the urinary bladder. So which vessel? Mostly the inferior vesicle, then artery from the rectum, that is the middle rectal artery and internal pudendal artery. Now you can see here the prostatic venous plexus. We have two capsules, the true capsule and the false capsule. And in between these two lies this prostatic venous plexus. So it drains here and then it goes to the vertebral venous plexus. What nerve we have? We have again sympathetic. And the lymph node is internal iliac lymph nodes. Now, what I have already mentioned you about, that anatomically we have the anterior zone, median, anterior lobe, median lobe, and the posterior lobe. When this median lobe is enlarged, most of the time this median lobe is only enlarged, it will compress over. What do we have here? We have the neck of the urinary bladder, and it will give rise to the obstructive symptoms. So this is what we have theoretically. And while you come for the practical, you try to see the urinary bladder, the prostate, and try to see the posterior wall of the prostatic urethra. So urinary bladder, the prostate, these are important points. And then you can also see the ureter, the pelvic part of the ureter, and their arrangement in the male and the female. What are the important relation of the pelvic part of ureter in male and female? And most importantly, you should also look for the peritoneal reflection in male and female. So this, you should also know about the gender difference. What are the structure there in the male and what are the structure there in the female, and how the peritoneal reflection differs between them. So this is what we have today. You need to come and you need to see the structure again. If you have any question, you can ask. Thank you very much.
Doctor, I have a question.
Yes, please.
In female, we don't have prostate gland, right?
Yeah, we don't have the prostate. We don't have. Yes.
In slide 32, one function of the prostate is alkaline secretion, which help neutralize
Okay,
the
just
acidity of
yeah,
vagina.
yeah. This is like
How is that?
yeah. This secretion is for, like, prostate is a male gland, right? The prostate secretes the seminal fluids, and it combines with the sperm which is coming from the vas. Now you can see here, this is These are the testicles, and that produces the sperm, which passes through the vas deferens, and finally it mixes with the seminal vesicle, and finally the enters in the prostatic part of your urethra, and when it goes to the female reproductive part, here there it's not talking about in the male. When it goes to the female reproductive part in the vagina, the acidity is there in the vagina. So this is alkaline, and it neutralizes there in the female reproductive part. While it
Yeah,
comes
yeah, I
out in
get
the
it.
when it comes out in
Thank
the
you,
female
thank you.
reproductive, then it neutralizes there. Okay, any other question? Okay, thank you very much.